Good morning and welcome to the webinar. My name is Tracy Lawson and I am the lead broker advisor at Cornerstone. Today I am joined by our representatives from Anthem, Kentucky for their fourth quarter and 2024 updates. Before we get started, a little bit of housekeeping that we want to cover. Throughout the presentation, you will be muted. Should you have any questions, please feel free to enter those into the chat or question box, and we will address those at the end of the presentation. My information is on the screen if you would like to get in contact with me. Don't forget to follow us on social media and subscribe to our weekly Monday Minute newsletter. We keep you in the know with any industry and Cornerstone updates and information. If you are not currently subscribed for a Monday Minute, please do not hesitate to contact your Cornerstone broker rep to be added to the distribution list. With Cornerstone's agency services program, you are the pilot of your business and we are your flight crew. As a Cornerstone broker, you have access to expert services from our agency services program that can help you with business outside of your scope and planning for the future. We will create a customized plan for you based on your specific needs to ensure that you, your business, and your family are covered. Please contact your Cornerstone broker advisor for additional information. As a reminder, all webinars, including the one today, will be recorded. You will be able to view those on the Cornerstone website under the Resource Center if you would like to revisit at any point in time. And with that, we will turn that over to Lisa and Kathy from Anthem.
Good morning, everyone. We're going to get started with the updates for Anthem of Kentucky Small Group for 2024. I am the Anthem of Kentucky Small Group and Individual Account Executive at Anthem. I've been with Anthem for 37 years, a long time, and I cannot even believe that we're already talking about 2024. But we have a lot of great things to talk to you all about, and we'll get started with our presentation. As Tracy said, hold your questions to the end, and Lisa and I'll be glad to answer any of those questions that you all may have. Okay. Sorry about that. All right, let's get going here. Okay. Okay, so Anthem of Kentucky 2023 broker changes. The agenda for today, we're going to talk about our ACA and Kentucky ChamberAdvantage 2024 plan updates. We'll also talk about our Anthem Balance Funding, which we've had in the past that we are bringing back, our Wellbeing Solutions, Carolina RX Pharmacy, the Sydney app, broker tools, and our specialty products. So there are a few, if any, brands that are more widely recognized than the Cross and Shield. And this is just a screenshot showing you how powerful and how big Anthem is. We have 47.5 million Anthem members. 1 in 3 people are carrying a blue card. We have one of the largest in-network providers, networks that have 1.7 million doctors and hospitals, and we pay 97% of the claims that are paid in network. And what that means to our consumers is that they are saving money by us paying in-network claims versus out-of-network claims. So let's talk about some of the mandates for 2024. As you can see from the screenshot, some of the bills over to the left have failed. So those probably are not going to move any further. The ones on the right are bills that have achieved final passage. So the House Bill 148 is substance abuse use disorder assignment of benefits, and what that means is that they have found is that for out-of-network substance abuse centers and mental health providers. We were sending the check to the people that are struggling with addiction, and we realized that that probably wasn't a good thing to do and put that money in their hands. So this law has been passed that they will start sending those out-of-network provider checks to the provider and not to the member. The second one is the House Bill 170. It's a mandate for cancer-related fertility treatments. It requires insurers to cover cancer-related fertility treatments and storage for sperm and oocytes for 1 year. House Bill 180 is a biomarker testing mandate. It mandates coverage for biomarker testing for diagnosis, treatment, and management of an insured disease. And then Senate Bill 42 requires Finance Cabinet to issue an RFP for vendor to review all medical claims and recover any inappropriately paid claims. As you all know, every year the IRS changes the HSA qualified plans and increases the minimum deductible and out-of-pocket. So for embedded HSAs, it's going from $3,000 minimum deductible for an individual up to $3,200. For the minimum deductible for family, it's going from $6,000 to $6,400. The out-of-pocket max is being increased from $7,500 to $8,050. Your out-of-pocket for family max is $15,000 to $16,100. And as you can see, the non-embedded is the same. As you know, we don't have any non-embedded HSAs at this time, but we are rolling out some for 2024 that we'll talk about in just a minute. This is the maximum out-of-pocket for ACA limits. As you can see, 2023, the embedded max was $9,100 for single. It's going to $9,450. The family is $18,200, and it is going to $18,900. So let's talk a little bit about our changes for 2024 on the medical product reviews. As you know, we offer an ACA, our Affordable Care Act plans. We also offer our Kentucky ChamberAdvantage plans that are also referred to as our MEWA plans. And we will have some options for the Anthem Balance Funding that we'll talk about in just a minute. So here are some of the small group highlights. This applies to our Affordable Care Act plans and our Kentucky ChamberAdvantage plans. So in 2024, all our plans will have the zero primary care copay for children under the age of 19. That is a great feature that we think everyone will be happy about, because we know that, you know, children do need to go to the doctor quite often, and this will help with costs for the members at a zero primary care copay. Also, we are putting in some new zero deductible PPO and HMO plans. We have some new non-embedded HSA plans. We have heard that our competitors have non-embedded HSAs. We have not been offering that, but we'll offer some this year just to help with cost. We also have some new embedded HSA plans. The link pathway EPO plans have been discontinued. We did not sell many of these. You all may not have any, you know, in any of your clients that have purchased any of these plans. These were our virtual plans that did have a different network, but it mainly was created around our virtual visits, and all our plans really have virtual visits now for a zero copay, so there really wasn't any need to continue with those products. Also, mail order medications now have reduced member cost sharing, so we'll talk about that in a minute too. So the main thing that you all just need to think about is the two networks that we offer on our small group plans, ACA and our ChamberAdvantage, is the Blue Access PPO network, which is our largest network. It accesses the National Blue Card. It has in and out of network benefits. It is a very, very broad network. It taps into all the other Anthem states. That is our most popular network. The other network we offer is our Pathway HMO network. It is more of a narrow network. It only has in-network benefits. Any out-of-network benefits would not be covered unless it's an urgent or emergency care. I will say that this is a good option to keep costs down. We do have all the major hospitals in Kentucky, in Louisville, I should say, in this network. St. E's is in this network. We just don't have any out-of-state providers except for Christ, which is in Cincinnati, Ohio. And then we have a very small number of Southern Indiana providers in that network. The Pathway EPO network is the network we use for the Anthem Link products. That is being discontinued. So some of the medical plan updates, so some of the things within our plans are changing for 2024. Again, this is for ACA and Kentucky ChamberAdvantage. We already cover cellular and gene therapy under the human organ tissue transplant benefit, but we are going to require members to use the Center of Excellence provider in order to receive in-network benefits. Our RX Choice tier networks, our level 1 pharmacies versus our level 2 pharmacies, are currently about $10 or 10% difference between the level 1 and the level 2. In 2024, that we're going to increase that differential between $15 or 15%. So if you use a level 1, you will pay less. Between the level 1 and the level 2, the difference in what the member will pay is either going to be $15 or 15% depending on your plan design. Also, our RX home delivery, currently our multipliers for 90-day supply is 2.5 copay for tier 1 and a 2.5 copay for tier 2 and then 3 copays for tier 3. We are moving to a 2 copay for a 90-day supply for tier 1 and 2 copays for a 90-day supply for tier 2, and then it will stay at a 3 copay for tier 3. We're trying to encourage people to use the home delivery and make it more cost effective for them. Our well-being solution packages, so our well-being solution packages in all our small group plans are going to include the Kentucky Engagement 200, and we'll talk about that a little bit more in a minute, our Diabetes Prevention Outreach Program, and then our Smart Shopper Program. And that is embedded in all our small group plans at no extra cost. For the legacy plan, so if you have any small groups with Anthem currently that are on a grandmother plan, the only thing that's changing with their benefits would be the cellular and gene therapy, where they have to use the Center of Excellence provider to get paid in network. So as you all know, our Affordable Care Act plans, there's no medical underwriting, they're fully insured. To me, it's a great option for groups that are maybe new to offering group insurance, and also maybe for groups that might have poor health. I can tell you we've sold quite a few ACA groups today, more than we have in the past. It becomes a really good option for people that, again, maybe don't have the best health risk in that group. Maybe they've gotten a Kentucky ChamberAdvantage plan. We weren't as competitive. They've ran our ACA and gone with the ACA. So just keep that in mind. When you're quoting Anthem of Kentucky products, always ask for both an ACA and a Kentucky ChamberAdvantage plan, because you might be pleasantly surprised that our ACA plan may be a good fit for your group. And on the ACA, again, we offer the Blue Access PPO and the Pathway HMO network. This is just a snapshot of some of our new plans for 2024. We will have our plan guides, our new forms, everything that you need to start selling for 2024. They should be available around the 1st of October, and we will get those out as soon as we have those. Also, around the 1st of October, you will be able to start quoting our quoting for 1/1 effective dates. So as you can see, for ACA, we have put in about 3 plans that are 0 deductible plans. Those are 2 platinum and a gold plan. We have about 4 non-embedded HSA plans that we are putting into place, and then 4 embedded HSA plans. I want you to just keep in mind to decipher which one's embedded and which one's non-embedded. If you see an E behind the deductible name, so as you can see, the Anthem Silver Blue Access PPO 3500E, that means that it is an embedded HSA plan. If you don't see the E behind the deductible, but it still says HSA or with HSA in the name, that means it's non-embedded. And then we have about 5 plans that are being discontinued, mainly because we really didn't have any membership on those plans. On our ChamberAdvantage plans, also known as our MEWA plans, those are medically underwritten, as you know. We have 3 zero deductible plans we're putting in. We've put in about 6 lower deductible plans, from a $500 deductible up to a $2,500 deductible. And then we've got 3 non-embedded HSA plans. And the discontinued plans are Anthem Link plans. Again, those are plans that we probably have none to very little membership in. So let's talk about some of the changes for our ChamberAdvantage plan. I want to just point out that our ChamberAdvantage plan has been a fantastic option for a lot of our employer groups out there in the market. We have grown to 45,000 members year to date. Retention, we've got 90% retention for 2022. I do want to point out is, as you all know, there are product dues that are owed by the employer. It is billed monthly on a separate invoice by Anthem. Currently, they pay $4 per employee per month. That is being increased in 2024 to $5 per employee per month. That will take effect for any new business coming on 1/1/2024, and then any groups that are currently with us at renewal, it will be increased to that $5 at their renewal time. I also want to just remind everybody that it is a requirement for groups to participate in our Kentucky ChamberAdvantage plan that they also have a membership with a local chamber. It can be any chamber. It just has to be they just have to have a membership with the chamber, and they have to prove with documentation when they apply with Anthem to show that they do have a membership with a local chamber. They also have to keep that in good standing. So if for some reason they pay for the membership 1 year and then they let it lapse, if we get notification that they no longer have a local chamber membership, we will have to cancel them at the renewal time. So just make sure that your clients understand that they need to keep that membership with the local chamber intact. Some census change rules for requotes and sold submissions. You are probably aware on sold submissions that we do have the rule that if you all quote the Kentucky ChamberAdvantage plan, and then the census changes, they add a dependent or employee from the time that they quote it to the time that they enroll it as a sold case, it needs to be requoted before you submit the sold paperwork. We're also enforcing that on requotes. So this is kind of how the rule goes, and I know it can be confusing, and I know Cornerstone will work with you all on this, but I just want you all to be aware of it, because I know they normally will run your quotes. But if you have a requote, so you quoted a group and you realize that you've got, the employer comes back and say, hey, I need to add 1 more employee, or I need to add 1 more dependent. If it's just 1 employee or 1 dependent and you have to requote it, we will require an individual health questionnaire for that 1 employer or that 1 dependent. And that is regardless of size. So as you all know, if it's under 6, we require individual health questionnaires. If it's over 6, we do not. Even if the group has 10 enrolled employees originally, and they're adding just 1 employee, we would require an individual health questionnaire for that 1 employee. If the group has 6 or more employees and the group adds 2 or more employees or dependents, then we will run it through what we call our curve tool, which is our prescription claim tool that pulls prescription claims in. So it would have to be requoted regardless if you add a dependent or employee. It just depends on whether it depends on whether we need an individual health questionnaire or whether we'll run it through the curve tool, depending on how many you all add. Also for requotes on sold groups, so if you are quoting a group and you get ready to submit it as a new sold case and they have less than 20% reduction in change, so you're taking people off and it's less than 20%, we will hold the rate factor and hold those rates. But if it's more than 20% reduction, then it has to be requoted. So the best rule of thumb is to really go on and requote it before you send it in for a sold submission. That way there's no surprises to your clients and no surprises to you. But the best rule of thumb is that if the census changes from the time you quote it to the time you submit the sold paperwork, you will need, you really should have Cornerstone requote it before that is submitted. Also, DocuSign, we do have DocuSign for brokers. Brokers can sign on behalf of the employer through our quote to enroll tool, or they can send it to the employer to sign. And if that's the case, the broker will receive an email notifying him or her the employer has signed and returned the DocuSign forms. So let's just talk a little bit about our Anthem Balance Funding. Some of you all may be aware of this product. We did offer it, gosh, I don't know, maybe a couple years ago. And unfortunately, it wasn't rolled out as well as we would have liked it to be. We are going to roll this out again. We have our own department of underwriters just for this product. Anthem Balance Funding is a payment arrangement that fits clients who are seeking a self-funded solution with a fixed monthly payment and no additional terminal liability. So it's going to look like a fully insured plan, but it's giving the client the option of getting a surplus back if their claims are low. Also, we do have some reporting that will be given on these type of plans to kind of give the clients an idea of where they are at in their journey as far as their claims and health utilization. So this is just a snapshot of what our Anthem Balance Funding plan is going to include. It's going to have a $20,000 specific stop loss, 110% aggregate stop loss, a 12-12 coverage period run out. I think that's going to be more like a 12-15, but we need to get some more information on that. But I think that's really how it's going to work. 50% surplus refund is available if their claims run low, and then a $28 commission that is for per employee per month. And then it is available for non-ERISA groups. This is, to me, the Anthem Balance Funding plan is going to be for groups that have a younger, healthier than average, maybe employees. They want to be actively engaged with their group's overall health and be rewarded for it, and desire more transparency and more reporting. This is just a snapshot of what the quarterly Anthem Balance Funding report will look like. My understanding, this will go to the client. This is something that you can use to sit down with the client, track how they are as far as possibly getting a surplus at the end of the year, and see what's driving utilization. Some of the highlights for Anthem Balance Funding plan is quoting is going to begin for this product 11/1/2023. Unlike our ACA and ChamberAdvantage plans, you can start running those around October 1st for a 1/1 effective date. But Anthem Balance Funding won't be available to start quoting until 11/1 for a 1/1 effective date. The quotes will be ran through the producer toolbox just like we do our ACAs and our Kentucky ChamberAdvantage plans. You must have 10 eligible and 10 enrolled to receive a quote. So just keep that in mind. You need to have at least 10 employees enrolled to even be able to get an option of the Anthem Balance Funding. And also, you must be an existing level funded group to receive a quote. So the group must be on a level funded group at the time, and we will ask for that information when quoting in order to get an Anthem Balance Funding quote from Anthem. Anthem does reserve the right to decline to quote, and more broker training will take place in October. So once we have a date on when we are going to train the brokers more on this, just stay tuned. We are getting more familiar to it also as an account exec and account manager. So if you have any questions about this at the end of this, feel free to ask. We may not be able to answer it, but we can get back to you with the answers. But just keep in mind that there is more training for the broker on this product. So let's talk about our wellness programs. These are programs that are built into all our small group plans. It includes our foundational package. It includes the engagement package 200, our diabetes prevention outreach program, and then the Smart Shopper. Again, all 3 or 4 of these wellness programs are included in all our small group plans at no extra cost to the member. This is a snapshot of our well-being foundational programs. These are at no cost to the employer or the member, but they are great tools to keep employees on track. Just a couple of changes or enhancements on this. You're probably familiar with this. We have the 24/7 nurse line, the condition care programs, complex care programs. The only thing that really is new for 2024 is that we are changing the name of Future Moms to Building Healthy Families, and I'll expand on that in a minute in another slide. Also, if you're not aware, we do currently have the Cancer Care Navigator program. It's a clinical program that we offer also, which is a great feature. We've enhanced that. And we also have the Back and Joint Pain Guide. That is another clinical program where we help people manage their pain. And it has been extended to not just back pain, but to knee, hip, and shoulder pain. And we'll talk about that a little bit more too. So this is our Engagement 200 package. This is a program where the employer and or the spouse can earn up to $200 each maximum in gift cards just by doing their wellness and taking care of themselves. Some are claim-based, as you can see. Some, they're automatically going to get a gift card if they go get a dental exam, get a dental cleaning, if they get their physical once a year, if they have their mammogram, flu shots. So they're going to automatically, when a claim comes in, we're going to automatically give them a gift card for $25, $20, whatever the case may be. We also have programs that they can do online, like their health assessment. They can earn $20. They can just log into our web or mobile app. They get $5. They can track their steps. And then the condition care management, if they work with one of our condition care navigators or nurses, then they can also earn money or gift cards from there. All this is going to be on the Sydney app, which I'm going to talk about a little bit more in a minute in detail. Our Sydney app is fantastic. I can't talk enough about it, and I think it's really something that differentiates us from other carriers. But all this is going to be on their Sydney app. So this will be at the members' fingertips. They can monitor how many, gift cards that they have earned so far. These are digital gift cards that'll either be a MasterCard, it could be Amazon, Target. We just added Uber and Uber Eats, TJ Maxx, Home Depot, etc. These again are digital cards that they can obtain on the Sydney app once they earn these credits. And the only thing I want to point out is I know there's some people that maybe aren't tech savvy that would prefer to have their digital MasterCard mailed to them. They can opt to do that at a $3 fee. And again, this is on our ACA and our ChamberAdvantage plans. So let's just talk about a little bit about our pharmacy, Carelon RX. So Carelon RX, which you all used to know as Ingenio RX, we are now Carelon RX, and Anthem and Carelon RX are committed to whole person health. The Carelon RX experience is going to offer 24/7 text or chat directly with the pharmacist at any time. It's enhanced end-to-end order status tracking from prescription order to delivery, and enhanced easy-to-use self-service digital tools. Another thing it's going to offer is savings. So we've got they're working on so many different things, from coupons and different ways that people can save with their prescriptions. Carelon RX Pharmacy will become the new exclusive home delivery provider for Carelon RX in 2024. So let's talk about making your all's life easier as a broker. I am so excited about this broker launchpad that we are launching out there for our brokers. The great thing about this is we know that we have many tools for you all to use or for your employer to use. And sometimes you all don't know where to go for what. We have the broker hub, we have the producer toolbox, we have the employer access. You can go to the broker launchpad and you can find out where to go for what. So it's an easy one-step navigation to get what you need in an instant. It shows you a quick description, a preview, and includes links to each tool. It also shows you when to use each tool. So the broker hub is going to be where you're going to find your marketing pieces. So anything you need to maybe send to the employer or your members, or you just want to learn more about our products. Producer toolbox is where you do your quoting and your enrolling. Also, there's forms out there. And then the employer access is a tool that you as a broker can use and your employer can use to add and delete employees. You can look at bills, you can make payments, you can order ID cards. So this is going to be your one-stop shop. It is a fantastic tool. Like I said, you can go directly to this broker launchpad and find out where you need to go for what, and click on a link and it's going to take you right there. Some of the enhancements we've done for the producer toolbox is we are trying to eliminate duplicate data entry. So when you do a quote census to get a quote, if you upload it in Excel or CSV file format, then once you enroll the group or submit the sold paperwork, it will auto-populate into your online census enrollment tool and reduce entry time. Another thing we're doing is quick renewals and specialty add-ons. It's a digital view of all the plan options from the renewal packet with no more downloads, and then it also will give you alerts for specialty product opportunities for those existing groups. And then online submissions for renewal changes and specialty product additions. It's going to reduce turnaround time for processing. So we know healthcare can be very confusing. I can tell you that members love the Sydney app, and it is rated 4.8 stars on the App Store. And Sydney has received multiple industry awards, as you can see from this slide. So let's just talk about what Sydney can do for your members. So we found that 85% of the Sydney Health users stay engaged with the app. And basically what this does for you is with the Sydney app, members have access to an integrated benefits hub for medical, specialty, and pharmacy. Sydney Health connects your members to all the resources, tools, and information that they might need. It's not just about calling customer service or going online and checking a claim. It's about being able to use your smartphone to check the authorization status of a specialty medication, chat live about what's going on with your child, or do a virtual visit with a doctor. These are some of the virtual visits you can do on the Sydney app. You probably know that you can do a visit with your primary care or a doctor through virtual visits. on the Sydney app at a zero copay at any time. You can chat with them, or you can video. You can just text chat with them or video chat with them. Also, we offer express exams. It's online vision exams in 10 minutes or less for contacts, lenses, and prescription renewals. And it's available 24/7. We also have dental at home, virtual urgent care and problem-focused exams 24/7 from your smartphone. We have ortho at home, which is teeth straightening and clear aligners. This is also offered online. And new for 2024, we have dentures at home. This offers custom fit premium replacement dentures from the comfort of your home at the fraction of the cost. So, and also just want to go back, keep in mind that the Sydney app, real quick, I want you all to know that it offers so many other things. You can review a claim. You can see where you are with your deductible and your out of pocket. You can also order an ID card. When you're in the doctor's office, you can pull it up and your ID card is right there. You can actually send it from your phone to the doctor's office if that is needed. There's so many order prescriptions. There's so many different features on the Sydney app. I encourage you, if you all have not downloaded the Sydney app and your members have not downloaded the Sydney app, I definitely encourage you to do so. You can also go to our broker hub and find any materials you need to promote this feature. But it really is a good feature. And once you get used to it and have used it, I promise you, you and your members will love it. So let's just talk about real quick our cancer care navigators. What these do is they help patients understand their diagnosis and treatment. They work with the patient throughout their journey, including physical and behavior health, as well as local and national community resources. It also comes with the Cancer Digital app that provides real-time messaging with your navigator. The great feature about this is we all know somebody, unfortunately, probably that has been touched with cancer, and it is a scary thing to go through. And we try to make it easier for those members. We have 24/7 access, Sydney community digital tools, a concierge care app that they can reach out to their concierge, their navigator at any time with any questions. So it's a really good feature that is, again, through the Sydney app, where anybody that is going through this and has any questions, that they can help them through their process. We also offer diabetes prevention outreach program. We partner with LARC, who is a leader in the diabetes prevention. Members who meet the CDC clinical guidelines may enroll in the program, where they can get nutrition and weight loss coaching, including a wireless scale and a fitness tracker. This program is especially for members who are pre-diabetic. And I mentioned the back and joint pain guide. This is a personalized, non-surgical pain relief program for back, hip, shoulder, and knees. It connects employees with doctors, physical therapists, dietitians to help build strength and manage pain. A customized program is carefully developed to address pain, strength, and additional issues impacting their health. It's a 6-week online coaching program. And again, that is available through the Sydney app. And we talked about future moms going to building healthy families. So you're used to the future moms. Now we're going to be calling that building healthy families. So this is replacing the future moms. This is an end-to-end digital solution that goes beyond traditional maternity support to offer helpful resources from preconception through early parenthood. It includes tools and trackers, high-touch member interactions, and access to digital library resources. So let's talk about specialty real quick. We really don't have a whole lot of changes, but just kind of want to talk just a few things. This has been around for a while, but want to just make sure that everybody is aware of it. When you bundle your ACA specialty products, we can give up to 5% off the dental and vision, or the dental and life, or the disability product. The main thing you need to remember is, in order to get the 5% savings on the specialty product, you have to purchase a dental plan along with another specialty product. And again, on ACA, we cannot discount the medical, as you all probably know. So we discount the specialty products. So the more, so as long as they, again, offer a dental, then they can get 5% off the dental and 5% off the vision rates. If they put in dental and life, again, they get 5% off the dental, 5% off the life. The main thing to remember is they do have to have the dental bundled with another specialty product. For ChamberAdvantage, we also offer a bundling discount. This discount comes off the medical rates. So you can get up to 3% off the medical rates as long as the group did not get the best rate factor or the max rate factor. Anthem underwriting will give up to 3% off the medical rates for adding specialty. So the more you sell for that, you package with that group, the more savings that they're going to get. As you can see, medical and dental, they get 1% off the medical rates. If they do a vision, they get another 0.5%. Life's 0.5%. Short term's 0.5%, and long term's 0.5%, for a total of 3%. That is given once the sold case is submitted. So just keep in mind that if you quote it and it sells, once you submit, or Cornerstone submits the sold paperwork for you, then underwriting will see that they're purchasing these specialty products, and they will send a revised quote or rate out to Cornerstone to give to you and to the employer to show the up to 3% discount. So listen, we talked about dentures at home, ortho at home. Also, well, this is just a snapshot of our dentures at home. Again, it is quite a bit of savings. The member could pay $347.50 if they do it online. For traditional dentures, if they go to a dentist, it could be $697.50. So this is a snapshot of showing how they can save money. That it is custom fit. It can save them up to around 60%. And again, this can be done through our Sydney app. And vision, the only changes on our vision is we are giving discounts for 2 prescription eye drops. One is for myopia, and the other one is for dry eye syndrome. I will tell you that the discounts are about up to 30% discount on these 2 prescription eye drops. It does have to be done through mail order, and my understanding is the provider, the eye doctor provider, would have to file the prescription mail order for these discounts for the member. And I am going to turn this over to Lisa just to give you a brief update on our life and disability, and then some existing changes going on. Some changes going on for existing business. Lisa?
Great job, Kathy, and thank you so much. Good morning, everyone. I am Lisa Wilson, an account manager with Anthem. I've been with Anthem for 24 years, and I am just going to quickly go over some small group existing business updates with you. Kathy, can you go to the next slide, please?
Yeah, you don't see the life and disability migrating?
No, I don't see that one yet. Sorry.
Uh-oh. Well, it might not be that you can see these. You see my slides moving?
I don't. I'm so sorry.
Okay, that's okay.
I do. Go back to the one. Sorry, guys.
Can you see it?
No, it's just taking a little bit of time, but I think I know. I'm just, I think I can read off. Maybe it's on my end, but let me do this real quick. Bear with us just a second.
And if you can, I can speak to it, not a problem. Just let me know.
Well, I can speak to it. I had written some notes down here, and the one that I have in front of me, so, oh, it's there now. I just want to share with everyone that we currently have the life and disability migrating over to the standard. Just a couple notes around that. All existing life and disability membership is migrating to a system called Compass. Right now, Anthem have currently different systems that we work with. So everything's migrating over to a system called Compass because that's what the standard, they have purchased that system from Anthem, and that is one system that they will be able to work with. That migration will take place starting August through February of 2024. Any small group that you have new life and disability coming on board today as of 9/1/2023, all of those will be housed on the system called Compass. Communications, you probably already started seeing some communications going out. So our life and disability team is sending communications out to both brokers and employers. The brokers, you're going to get an email. And the next slide, I'm gonna kind of talk about, what you're probably seeing in your email, but employers are going to receive a letter. And the employers' letters are a little bit more detailed. It's gonna give them a little bit more information around what they need to do. As far as the broker's communication, you're going to see just probably a grid in there. So this grid shows if you have renewals in the month of January, they're going to start migrating over next month in the month of October. And then February and March renewals, September, April, June, November, July, September, December, and so forth. So this is our migration schedule. We have been given a list of just the dates of the renewals and when they will move over. But each employer will get a notification of when that group is actually being migrated over to the new system. And I think there's just probably a delay on my end, but I do have another slide show up. So the existing business updates. Another update that I want to share with you is the medical loss ratio. Yes, the Anthem Kentucky small group, we were in a position that we received for 2022, the medical loss ratio was at 74.5%. Anthem will be rebating over 3,600 small employers. So our average rebate was $2,680. Checks have already started to be mailed. So a lot of the employers probably already start receiving checks. I've got several emails asking, what is this check for? The check is mailed straight to the employer. It has a letter explaining what the check is for. And it also has a frequently asked question. So they can kind of review that and understand how the refund can be used on their end. I'm not sure if you guys have that slide up, but I have it up on another end. MEWA reminders. I just want to talk a little bit about second renewal dates for the ChamberAdvantage. When we rolled the ChamberAdvantage out a few years ago, we only had one renewal date, and that renewal date was 6/1 for the common renewal date for our MEWA plans or ChamberAdvantage plans. We now offer two renewal dates. So we offer June 1 for one renewal date, and also October 1. So this slide here will show you, for an example, any new groups sold from July the 1st to December 1st, those groups will receive a renewal date of 10/1. So they can get up to 15-month contract length when they come on for July. And then there's example there. And then any new group sold from January to June 1st, those groups will receive a 6/1 renewal date. So great news, we now offer two renewal dates. And some of you may be aware, but Anthem offered last year, we offered some of our 6/1 existing groups already in place. We offered them an extended renewal, and we asked if any of them wanted to move to a 10/1 renewal date. I will share with you right now that's currently a pending decision that underwriting is looking into with our actuarial team. And we'll know a little bit closer once you start working on those June renewals if we will offer that again for 2024. So the next slide is basically going to show you, and I believe this is going to be a presentation that we will be able to share with you. So you will have this at your fingertips. This slide here is just a contract grid. So it will help you. It's very, very handy. Very, very good information to keep by your side when you are writing a new group into the MEWA. This will tell you if you write a group in June, it'll tell you how long of a contract month they will receive. It'll also explain to you when they will renew, and then it also will share with you their renewal dates. That's good. That a good reminder. If you write a group, say for instance, if you write a group July the 1st, and that group will not renew until, say you wrote a group July 1st, 2023. Well, that group is not going to renew until October 1st, 2024. But they will receive an open enrollment October 1st of this year. So if you wrote any new business for July the 1st, they will receive an open enrollment this year in October. And then they will receive an open enrollment every October going forward, because they have that 12-month rule that we have to offer a group a 12 months of an open enrollment period. Next slide here is just reminders on the small group grandmother business side. Our January grandmother renewals are really, she's working on those. We are hoping they'll have those out closer to the last week of October, if not the week prior. I was informed that we're looking at the average renewal is coming in right at about, it's single digits, right at about 7.9%. But we do know that they are single digits, so that's great news. Grandmother groups will be allowed to upgrade or downgrade. When we first had those grandmother groups out there, we could only have an option to downgrade to a lesser benefit. Well, we have been informed that the grandmother groups can now, at their renewal, they can have an upgrade benefit or a downgrade. But the one thing around it, it must remain in the same product family. And what I mean by that, if you have a group currently today on a PPO plan, they have to remain in the PPO plan family. And then HSA, they have to remain on an HSA plan. Groups that currently offer a dual option. So if a group have two plans right now today on a grandmother plan, they can continue to have a dual option. But the only change is not a change, but it's a rule around it. If a group have a single plan today, we cannot add a dual option onto that, because that will pierce the grandmothering status. So a single plan must just continue to enroll on a single plan or make changes to a single plan. And if you have a dual or triple options, those plans can continue to have a dual or triple option. The next bullet there says contact the AM for alternates. There's been an update on that. All alternates for our grandmother plans will be included in the renewal packet. So that's good news. And then my last slide here, just a few more reminders. Existing business, if you want to or need to quote a ChamberAdvantage, you can do that. As Kathy talked about the producer toolbox, you would just go right out there, take a grandmother plan, ACA plan. You would quote it just like you would a brand new group. So you'll go out to the producer toolbox on your existing business. The only change that you would do that you don't perform right now for your new business is you will answer the question yes, that this is an existing business, and you would enter the group number. That's very important on how the group will be underwritten. If you have an existing,
real quick, it's Tracy. I just wanted to add, those quote requests will still continue to come to Cornerstone, and we will take care of running those for you. Just make sure you indicate in the body of your email that it is a current Anthem group with their current group number.
Awesome. And thank you, Tracy. We got different audience that we speak to, and Tracy, you're definitely right. Please make sure that you go through the Cornerstone for those quotes, and they can get those quotes out to you. And the same thing, if you have an existing business Anthem group right now with us, a medical group, and they have ancillary, I strongly recommend that your Cornerstone rep will also run those ancillary quotes for you. Do it all at one time, so then you can see, exactly what the rates are and the plans are. All SIT codes are eligible in the ChamberAdvantage program. So those updates is really all that I have to share with you guys. So right now, I'm going to turn it back over to Tracy so she can open it up and we can review the questions that came in the chat box. Tracy?
Okay, so a couple questions we have here specifically on the balance funding plan. And they're asking if the request for the balance funding proposals need to come in separately. And does that product have a common renewal date?
Separately, I'm not real sure. I mean, it's going to be quoted. I'm not sure what that means separately, but it will be quoted through the quoting tool, just like ACA and ChamberAdvantage plan. As far as the renewal date, I'm not sure. Like I said, I apologize. We are still getting trained on that. We actually have a meeting today at 1 o'clock, and we're having the people from our Anthem Balance Funding come speak to us a little bit more in detail about this. We will definitely, I will promise you, we will get more information out on the Anthem Balance Funding, and there is training for all our brokers coming in October. So I apologize. I don't know what the common renewal date will be, or if there will be a common renewal date. I don't think there will be. My guess is it'll probably renew just like our ACAs. It'll get a 12-month, but I could be wrong. And it will be quoted just like you would an ACA or a ChamberAdvantage.
Okay, so as additional information is released by Anthem on that, we'll make sure that we get that out to the broker community. And should you have any questions, don't hesitate to reach out to your broker advisor. Okay, so the next question, could we get a sample of what the MLR letters look like that have been sent to the group, along with a frequently asked question?
And Tracy, I'll take that question. Absolutely. I will send that over to you, Tracy. I will get you a sample letter of what it looks like that's going out to the employer. And I do have a copy of the Q&A frequently asked question, and I'll share that with you as soon as our call is over.
Okay, all right, perfect. Was the average renewal of 7.9% just for grandmothered groups, or is that MEWA as well?
Currently, right now, that is just for what I received on our grandmother groups. I don't have an update right now, or I haven't been provided for our ACA groups. It's not for our MEWA. We do not have any groups renewing for January. All of our MEWA renewals are 6/1 or 10/1. So the 7.9 single digit is actually just for our grandmothers.
Okay, will any of the plans cover, not sure what this is, GLP-1 insulins? And I think in that one, I would recommend that you reach out to your specific Cornerstone broker advisor, and they can discuss that in more detail with you. Okay, and that's all I'm seeing. Jess, are you seeing anything else out there? No? Okay. All right. Well, if there are no other questions, thanks to Lisa and Kathy for joining us today, and we appreciate your attendance.
Thanks, everyone.
Have a great day.
Uh-huh.